Hi, this is Rahul Pandit, and here I'm demonstrating surgery to implant the small incision new generation implantable miniature telescope, the SING IMT. This novel device is a product of the company Samsara Vision. As you can see here, this involves cataract surgery with removal of the cataract. The initial steps of cataract surgery are routine, with the exception that the incision size is approximately 7 millimeters. I begin the incision with a guarded diamond knife to ensure that it has a good shelf to it for better closure later on. The incision is a typical corneoscleral groove, but I do place the incision superiorly rather than my usual temporal approach for better access and implantation. Once the cataract is completely removed, I inflate the capsular bag, quite full, and then I enlarge my typical 2.2 millimeter cataract incision to the full length of 7 millimeters with a crescent blade. Here I create a peripheral iridectomy. Next, I examine my implantable miniature telescope device under the microscope. It has three haptics. They are black. They expand in the capsular bag into a triangular pattern. I want to ensure that the two haptics that are going to be placed inferiorly are facing up as I insert the lens, because the trailing haptic is pointed downwards. You cannot see it, but that's what's going to enter the capsular bag subincisional, and that will be superiorly placed. You can see I'm very slowly injecting the lens, taking great caution not to press too firmly, as it is much larger than a typical intraocular lens, and do any damage to the capsular rhexis or the posterior capsule. And once again, this is why the prior step of completely inflating the capsular bag is quite essential. Once the lens is comfortably in the bag, I gently press at the haptic-optic junction in the fold of the haptic to ensure that it is placed adequately in the bag and that none of the three haptics are extending outside of the capsular bag in the sulcus. After pre-placing three sutures, I perform irrigation aspiration to remove the viscoelastic, and then I place my fourth suture to ensure good adequate wound closure. Then I trim the knots short and bury them and ensure that the wounds are self-sealing by hydrating the wounds. I will inject intracameral preservative-free moxifloxacin, and then I will do subconjunctival injections in this case as well, since this was performed under retrobulbar anesthesia. This telescope can be offered to patients who have severe end-stage macular degeneration in both eyes with severe vision loss. It's implanted in one eye at the time of cataract surgery to magnify their central vision such that they can see around their blind spot, but it is never done in both eyes because the other eye is implanted with a normal lens so that the patient can keep their peripheral vision to help them get around and ambulate.